mwlife.ca और आज डायबिटीज़ और उनकी कोजेस, सिम्टम्स, ट्रीटमेंट और टाइप्स के बारे में हम बात कर रहे हैं. Who is at risk for developing diabetic ketoacidosis? Risk factors for DKA include having type 1 diabetes, being a younger age, as research suggests 63% of DKA cases happen in people below the age of 51. Psychological shock, a life threatening condition caused by interrupted blood flow. Emotional or psychological stress, acute cardiovascular disease such as heart attack or stroke, acute gastrointestinal illness such as pancreatitis, having alcohol use or drug use order, having an eating disorder, certain endocrine conditions such as Cushing's syndrome and hyperthyroidism, recent surgery, pregnancy. Medications, certain medication can increase the risk of DKA. Some antipsychotic medicines such as clopazine, clozaril, olanzapine, Zyprexa, and risperidone, corticosteroids. These are the medicines which actually has issues with DKA. Ketosis-prone diabetes. Although DKA is less common in people who have type 2 diabetes, it does occur. Some people with type 2 diabetes are considered ketosis prone and are at higher risk of DKA. A diagnosis of ketosis prone diabetes is more likely for Black African American, Afro Caribbean, Sub-Saharan African, Asian, Chinese, Indian, and Japanese and Hispanic people. People who have overweight or obesity, people who are middle-aged, males. It's best to talk with your doctor about your risk factors to make sure you have the right treatment plan in place. Testing for ketones. Testing for ketones is one of the first steps for diagnosing DKA. If you have type 1 diabetes, you should have a supply of home ketone tests. These test either your urine or your blood for the presence of ketones. You can buy these drugs in stores or online. According to Diabetes Association, you should test for ketones if your blood glucose level is high, if you are sick, if you have symptoms of DKA. Test your urine or blood every 4 to 6 hours. How to test? Urine test strips can change color to signal the presence of ketones in your urine. You'll need to pee on the strip or dip the strip into the pee you've collected in a container. The indicator on the strip will change color. Compare the test strips to the results chart. Blood ketone testers are also available. They're usually combination devices that can measure both glucose levels and ketone levels. Similar to blood glucose testing, you'll need to apply a small sample of blood test to a test strip. The test strip is inserted into a monitor device to test for the presence of ketones in your blood. A doctor or pharmacist can advise you on when and how to use your home ketone test. How is diabetic ketoacidosis diagnosed? A doctor will likely do a test to confirm the presence of ketones in your urine. They will usually also test your blood sugar level. Other tests your doctors may order include basic blood work, including potassium and sodium to assess metabolic function, arterial blood gas, where blood is drawn from an artery to determine the acidity, blood pressure, electrocardiogram, ECG, chest x-ray, or other tests to look for signs of an infection such as pneumonia. Preventing diabetic ketoacidosis. There are many ways to prevent DKA. Prevention means following your diabetes treatments plan carefully and taking some extra care when you're sick. Follow your treatment plan. You can lower your risk of DKA with proper management of your diabetes. Take your medications as directed even if you're feeling fine. Follow your meal plan. Test your blood sugar consistently as recommended by your doctor. This will help you get in the habit of making sure your numbers are in range. If you notice a problem, you can talk with your doctor about adjusting the treatment plan. Talk with your doctor about adjusting your insulin dosage levels based on your activity level, illness, or other factors, such as what you're eating. If you have high blood sugar and your blood or urine test detects ketones, do not exercise. Exercising with high blood sugar can be dangerous. When you have diabetes, it's best to talk with your doctor about how to manage the situation. Sometimes the cost of insulin can make it more difficult. To follow a diabetes treatment plan, you have to discuss with the doctor for the excess insulin and a reduced cost. When you're sick, although you can't completely avoid illness or infection, you can take steps to help you remember to take insulin and to help prevent and plan for a DKA emergency. A sick day plan can reduce the risk of DKA. Test for ketone levels when you're sick. This can help you catch mild to moderate ketone levels before they threaten your health. Set an alarm if you take your medication at the same time every day to you, or use a reminder tool like a phone app. Ask your doctor or pharmacist if it's okay to pre-fill your syringe or syringes in the morning. This will help you easily see if you missed a dose. Take the medication advised by your healthcare team to treat fever or infection. Have a soft liquid food available that are easier to eat if you become nauseous. If there's something helping to care for you when you're sick at home, make sure they have information about your diabetes treatment plan, including your medication and testing schedules. Call your doctor if you detect moderate or high ketones in home test. If you can't reach your doctor and you suspect you may be progressing to DKA, get emergency help. Early detection is essential. इस बारे में हम बातचीत जरूर जारी रखेंगे आफ्टर क्विक कमर्शियल ब्रेक.
हेलो,
ਤੁਸੀਂ ਕਿੱਥੇ ਹੋ?
ਕੰਮ ਤੇ ਆ ਯਾਰ, ਦੱਸ।
ਮੇਰੀ ਗੱਡੀ ਦਾ ਨਾ 132 ਸਟਰੀਟ ਤੇ ਛੋਟਾ ਜਿਹਾ ਕੋਲੀਜਨ ਹੋ ਗਿਆ. ਮੈਨੂੰ ਤਾਂ ਕੁਝ ਨਹੀਂ ਸਮਝ ਆ ਰਿਹਾ ਕਿੱਥੇ ਲੈ ਕੇ ਜਾਵਾਂ. ਨਾਲੇ ਮੈਨੂੰ ਤਾਂ ਇੱਥੇ ਸਭ ਕੁਝ ਬਲੈਕ ਐਂਡ ਵਾਈਟ ਨਜ਼ਰ ਆ ਰਿਹਾ.
ਦੇਖ, ਪਹਿਲੀ ਗੱਲ ਤਾਂ ਰੱਬ ਨੇ ਬਚਾ ਕਰਤਾ, ਠੀਕ ਹੈ। ਨਾਲੇ ਜੋ ਤੈਨੂੰ ਬਲੈਕ ਐਂਡ ਵਾਈਟ ਨਜ਼ਰ ਆ ਰਿਹਾ ਨਾ, ਉਹ ਲਾਜ਼ਮੀ ਬਲੈਕ ਐਂਡ ਵਾਈਟ ਆਟੋ ਬੋਡੀ ਦਾ ਸਾਈਨ ਹੋਣਾ ਹੈ। ਸੋ ਗੱਡੀ ਬਲੈਕ ਐਂਡ ਵਾਈਟ ਆਟੋ ਬੋਡੀ ਤੇ ਲੈ ਜਾ।
ਬਲੈਕ ਐਂਡ ਵਾਈਟ ਆਟੋ ਬੋਡੀ ICBC accredited ਅਤੇ ਫੁੱਲ ਸਰਵਿਸ ਆਟੋ ਬੋਡੀ ਸ਼ਾਪ ਹੈ। ਪਹੁੰਚੋ 7823 132 ਸਟਰੀਟ ਸਰੀ ਦੇ ਵਿੱਚ। ਕਾਲ 6045030988। ਬਲੈਕ ਐਂਡ ਵਾਈਟ ਆਟੋ ਬੋਡੀ।
कल सारे बड़े खुश सी।
होना क्यों नहीं खुश, पेट जो उनके खुश थे बानीज कढ़ाई वाला के डिशेस के साथ। बेस्ट कढ़ाई डिशेस ओनली एट बानीज कढ़ाई वाला। लाहौरी कढ़ाई, अचारी कढ़ाई, कबाब
बस
कढ़ाई।
बस 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 हुण नहीं रह जांदा। बार्नीज कढ़ाई वाला है किथे?
अपने सरी पिंड ते 8140 स्ट्रीट, second location 12889 84th Avenue, Surrey. Phone number 7785654416. चिकन, लैम, वेज कढ़ाई, नॉन वेज करी, हर किस्म के एपेटाइजर्स, नान, स्टफ्ड चिकन और लैम नान, बिरयानी, इनके डिशेस का क्या कहना। एक बार ट्राई करोगे बानीज कढ़ाई वाला, कभी नहीं भूलोगे। आप खुश, बानीज कढ़ाई वाला खुश।
मीडिया वेव्स, मीडिया मेरी।
जी हाँ दोस्तों, आप सुन रहे हैं www.live.ca और आज हम बातचीत कर रहे हैं डायबिटीज़, what it is, causes, symptoms and treatments and types of diabetes. और टाइप्स ऑफ डायबिटीज़ के बारे में काफ़ी डिटेल्स हमने आप लोगों को दिया. DKA is serious but it can be prevented. Follow your diabetes treatment plan and be proactive about your health. Tell your doctor if something isn't working for you or if you are having trouble, then they can adjust your treatment plan or help you come up with solutions or better managing your diabetes. So ये जो बातें हमने आपको बताया है कि everything you need to know about insulin, or insulin is a hormone made in your pancreas, a gland located behind your stomach. Insulin allows your body to use glucose for energy. Glucose is a type of sugar found in many carbohydrates. The body processes glucose like after meal or snack. Carbohydrates are broken down in the digestive tract and changed into glucose. That glucose is then absorbed into your bloodstream through the lining of your small intestine. Once glucose is in your bloodstream, insulin signals cells throughout your body to absorb the sugar and use it for energy. Insulin also helps balance your blood glucose level. When there is too much glucose in your bloodstream, insulin tells your body to store the leftover glucose in your liver. The stored glucose isn't released until your blood glucose levels is decreased. Your body glucose levels may decrease between meals or when your body is stressed or needs an extra boost for energy. Diabetes occurs when your body doesn't use insulin properly or make enough insulin. There are two main types of diabetes, type 1 and type 2. Managing diabetes with insulin. Injections or insulin can help manage both types of diabetes. The injected insulin acts as a replacement for or a supplement to your body's natural insulin. People living with type 1 diabetes can't make insulin, so they must inject insulin to control the blood glucose levels. Many people living with type 2 diabetes can manage their blood glucose levels with lifestyle changes and oral medication. However, these treatments don't help control glucose levels. People living with type 2 diabetes may also need supplement insulin. All types of insulin produce the same effect. They're used to mimic the natural increases and decreases of insulin levels in the body during the day. The makeup of different types of insulin affects how fast and how long they work. The type of insulin you'll be prescribed will vary depending on things like your age, your activity level, how long it takes your body to absorb insulin, how long insulin stays active in the system. Insulin is most commonly administered through a syringe, insulin pen, or insulin pump. The type of insulin injection you use will be based on your personal preferences, health needs, and insurance coverage. Your doctor or diabetes educator will show you how to give yourself the injections. You can inject the insulin under the skin in many different parts of your body, such as thighs, buttocks, upper arms, abdomen. Your doctor will likely also explain the importance of changing where your body you inject insulin to prevent lumps or fatty deposits from forming at the injection site. How to choose the right method for injecting insulin. Both syringes and insulin pens use a small needle to inject insulin into your body. There are pros and cons to each, and which one you ultimately end up with will depend on your lifestyle and your doctor's advice. Things to know about insulin syringes. They come in different sizes. Your doctor will tell you how much insulin you need per dose. You will usually draw the insulin into the syringe when you need it. They are not as discreet as an insulin pen. Things to know about insulin pens. Some pens use cartridges that are manually inserted into the pen. Other pens are pre-filled and thrown away after all insulin is used. Needles in pens are often smaller than those in syringes. Not all types of insulin can be used with a pen. Pens can be more expensive than syringes and are sometimes not covered by insurance. There are two ways to get your insulin without using a syringe or needle. Your doctor will decide if one of these options work for your personal needs. Deliver insulin continuously through a plastic tube placed semi permanently into the fatty layer under your skin, are typically placed in the stomach area or back of the upper arm, can deliver insulin more accurately than a syringe. Need to be told to deliver additional insulin for meals, may cause weight gain, may cause infection, may be expensive. Insulin inhalers deliver ultra rapid acting insulins are typically used before a meal. Commonly must be used along with injectable longer acting insulin. May cause less weight gain, may cause coughing. Don't have an exact doses compared with other methods. Require routine testing to monitor for side effects. Like food, insulin doesn't have a forever shelf life. It's recommended that you store any insulin you are not using in the fridge. However, injecting cold insulin may make the injection feel more painful. Because of this, a best practice is to keep the bottle of insulin you are currently using in a safe place away from direct heat and sunlight. Insulin kept at room temperature can also last about a month. Do not store insulin in the freezer and always check the expiration date before using it. Some of the side effects and reactions. Side effects from injecting or receiving insulin are rare, but can occur in certain cases. The symptoms of mild allergic reactions are swelling, itching, or redness around the injection area. More severe insulin allergies may include nausea and vomiting. In either case, talk with your doctor if you notice any of these signs. Hypoglycemia are blood glucose levels that are too low, sometimes occur when you take insulin. It is important to balance the insulin that you give yourself with food or calories. If you exercise longer or harder than usual or don't eat the right amount of calories or carbs, your glucose level can drop too low and trigger low blood sugar. Symptoms of low blood sugar include fatigue, inability to speak, sweating, confusion, loss of consciousness, seizures, muscle twitching, pale skin. Typically, a blood glucose reading of less than 70 milligrams per deciliter (mgdl) is considered too low for almost anyone using insulin. But you should talk with your doctor about what is too low for you. To treat this, carry at least 15 grams of fast-acting carbohydrates with you all the time. That's about equal to any of the following: half cup of non-diet soda, half cup of fruit juice, 5 lifesaver candies, 2 tablespoons of raisins, 3 to 4 glucose tablets. Alternative medications for people with type 2 diabetes. People living with type 1 diabetes must use insulin to help control their blood sugar, but those living with type 2 diabetes may be able to use oral medications to help manage their blood sugar instead of injections. Oral medication is typically prescribed along with lifestyle changes such as increased activity, weight loss, and diet changes. Medications for type 2 diabetes are designed to lower blood glucose levels, but they may not work for everyone. Typically, they work best for people who have recently developed diabetes and do not use supplemental insulin. Some medications, before prescribing any of the oral medications, your doctors will talk with you about your medical history and additional medications you take. If you're living with type 1 diabetes, your body does not produce insulin, so you'll need to continue to permanently take insulin. People living with type 2 diabetes can manage and maybe even reverse their diagnosis with lifestyle changes. According to the Center of Disease Control and Prevention, lifestyle changes that can help manage type 2 diabetes are eating a nutrient-dense diet rich in fruits and vegetables, maintaining a moderate weight, staying physically active. These lifestyle habits are also helping for managing type 1 diabetes, but they won't reverse the diagnosis. Additionally, you can help manage your blood sugar by eating at regular times, limiting the amount of alcohol you drink, trying to quit smoking, managing your cholesterol, taking your medication as prescribed, staying on top of your blood sugar with testing as prescribed. If you're living with diabetes type 2 or type 1, take insulin can help keep your body glucose level within the recommendation range. There are few ways to take insulin, from syringes to insulin pens to an insulin pump or even with an inhaler. Managing blood glucose levels help reduce the risk of diabetes complications such as blindness and the loss of limbs. In addition to insulin and oral medication, lifestyle changes can help prevent your blood glucose level from getting too high. Whether you've been prescribed insulin or have just recently been diagnosed with diabetes, talk with your doctor about ways to make your treatment as effective as possible. आज के इस प्रोग्राम से हम आपसे इजाज़त चाहेंगे. डायबिटीज़ के कोजेस, सिम्टम्स, ट्रीटमेंट और टाइप्स के बारे में हमने डिस्कस किया. इंतज़ार कीजिएगा अगले हफ्ते डायबिटीज़ जिनको है उनके लिए खाना क्या चाहिए, डाइट प्लान्स क्या है, वो लेकर हाजिर होंगे. अब हमें दीजिएगा इजाज़त. until next time, goodbye and be safe.